Long said there is no solitary confinement on Rikers Island, but a new whistleblower says otherwise. A former clinical supervisor for the city's jails says she witnessed the Department of Correction lock in detainees with mental illness for weeks at a time. Our investigative reporter, Courtney Groves, has more in this TV exclusive.
The administration says that there's no solitary confinement on Rikers Island.
Well, that's not what I saw.
Justina Rosinski left her job as a clinical supervisor for mental health on Rikers Island just 3 weeks ago. Her job, to work with some of the island's most seriously mentally ill detainees.
I just couldn't be there anymore, just seeing these individuals being locked in. A lot of times I couldn't even sit in my office because they were screaming and banging and I would hear them, so it was like really difficult just to pretend like it's not happening and do work.
Now she is sitting down with New York One in her first television interview to share her story. Days after uncovering a practice she says is standard operating procedure in the city's mental health units on Rikers, locking seriously mentally ill detainees in their cells for days, weeks, or even months at a time.
How long were people locked in for?
So it really depended, but I did have patients who were locked in for weeks, over a month. And a lot of the patients would rotate from one mental health unit to another. So if they were locked in one unit, they would be locked in the other unit. So it could be a few months.
And these are mental health units. This is where
Yes.
people are supposed to be getting better or
Yes.
higher degree or level of care.
Mm-hmm.
And they're clearly not getting that care.
Right, because when they're locked in, they're not getting their medications because the medications come on the unit or in the bubble. So they're not able to come out of their cell to line up to get their medication. And this is not just psychiatric medication, this is also medical.
So when they decompensate, what happens?
So they'll smear feces, talk to themselves, sometimes not move, sometimes flood the cells. A lot of times they bang and scream because they want to be released.
The process, she says, is called deadlocking.
There's a control panel where they open up and close the cells, and the cells are numbered. So they put a white piece of paper on it, and that means that the person is locked in.
She says it happens at the city's specialized mental health units on Rikers, where she claims correction officers will decide if a detainee gets locked in their cells for extended periods of time. That decision could be made, she said, if a detainee looked at an officer the wrong way. City jail rules say lock-ins should not occur for longer than 2 hours, and no detainee with serious mental illness should ever be held in solitary confinement.
So we are looking into the allegations wholesale. So I don't have a lot of specifics with respect to that.
This week, correction officials said they will investigate her claims, but still insisted the jail complex does not have solitary confinement. The Board of Correction, the jail's oversight body, too, is investigating. At a meeting this week where Rosinski testified, sharing her story, jail health officials did not deny the practice happened.
One of the challenges is having insight kind of generally about what's going on. So like Dr. Otonikar said, we're working on systems to help essentially identify how this is happening.
The detainee population with mental illness over the years has been climbing. More than half of detainees on Rikers Island get some sort of mental health services, according to the jail's health care provider. As of August, 20% have a serious mental illness. And now the question is, can the city care for them?
So I don't think that these individuals should be on Rikers because obviously they can't handle these patients.
Courtney Gross, New York.
But they're the ones that's creating those patients.